Okay, very good. And welcome back. Hello, everyone. Dr. Rich Castellano here, the Smile Doctor. And we are just getting things set up for Nala. How are you feeling, dear?
Great.
Okay, and it's amazing. I can do one, two, three clicks, and then I'm gonna adjust the. There we go. So that was 3 clicks, 4. Yeah, that's perfect. And 5, and we're on Facebook.com/Instagram, and we're on YouTube. Now let's show Nala's pictures. You see her neck with it yet, but you can see how this neck and jawline has improved considerably, okay? And all that excess skin down there. And so now
I want to have the rest years left that I have and be comfortable.
and she's talking a little bit goofy just because of the numbing medicine.
Mm-hmm.
That's normal with the numbing medicine, and that will go away. To make the most of the lives of our patients, make sure that they have safe treatments, get results that they like, and they absolutely will look natural. Okay, so we're all set up here, and I use my AvaGuard cleanse for the hands and put on our sterile gloves. And we have an outside consulting firm. They model all of our practices. Thank you to Universal Healthcare Consulting. We will be using the bruise patches today. Let's see, she brought those in. She got them right here. Yeah, I'll just hit the little button. So we will be using the bruise patches that have Arnica montana, and everybody's using Arnica montana for healing and bruising, but now we have it transcutaneous. So thank you to Acumen and Sierra. They do provide those patches for us. And we'll be giving some to Nala to go home with. I've never seen anyone take too much of the Arnica, but you should always consult your doctor, or don't take more than what's on the instructions to make sure that you get a safe dosing for that. But it is a benign over-the-counter medicine. Okay. Hello, Nina. We're in Tampa and in the Villages, Florida. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. And so now, since we're going to do just a little touch more of the numbing medicine here, do you feel a little pinch here or not really? We have the Arnica patches. Okay, so just a little bit of the numbing medicine. We monitor heart rate, we monitor oxygenation, we monitor blood pressure, but most importantly, we monitor Nala and make sure she's comfortable. We're in Tampa and in the Villages, Florida. So this is a 15 blade, and we'll just take away a little bit of the hair here, but does not remove that hair that grows right back in the incision line. Will hide very nicely right in the sideburn area. So that area, there's just a little bit of a vein, so I'll address that right now. Use the bipolar, and for the physicians and students that are watching, I can just hold pressure on that area, and you'll see it doesn't have any bleeding. And then 15, please. Okay, so we're in Tampa and in the Villages, Florida. You can learn more about us at imagelift.com or go to facebook.com/imagelift, or Instagram, go to imagelift now. Thank you. So there's a couple of little veins there, so it's very vascular on the edge. So I'm just going to raise this part right now, because normally I will let that sit for now, and then I'm just going to cauterize those little blood vessels while we're here. It's just right on the edge. You can see it, a dermal, sometimes we call them a little dermal vessel. And it's a vein, not arterial. Thank you very much. Very good. Everything's looking good. Thank you for watching. Thank you for sharing. We are broadcasting live. For those of you interested in our events, we have our seminars, imagelift.com/events. And release, please. Pricing. Some people want to know pricing. Go to imagelift.com/pricing. We have our price estimator with Build My Bod. Now, ear forward for me. So now I continue the incision. Auricular. I've already numbed these areas. Nala, are you feeling any discomfort at all?
Right there.
She feels a little pinch. So when she feels a pinch, and I'm going to do some numbing, and it's going to go away very quickly. You feel a little pinching here? So then a little bit there, so I'll just do a little bit of extra numbing. Thank goodness for lidocaine. We've got plenty of it. And I think people can be a little concerned if they're not familiar with the local anesthesia and how good of a job it does. But once you're comfortable with it, you don't want to do it any other way because the safety is unsurpassed. It's better for the patients. You get to know your patients better. They have a great experience. They say, wow, I didn't know you could do that under local. And what was it you were saying, Nala, about watching it versus going through the procedure?
It's easier to have it done.
It's easier to have it done than to watch it. Yeah, and her lips are a little goofy because of the lidocaine. But that's what most patients tell us. They say when they watch it, they're like, oh, it can be a little hard to watch for some people that are not used to watching surgery. But having it done, they're like, well, it was easier. I just had to lay there, and couldn't feel anything. Maybe I felt a little pinch here and there. And that's by design. We want you to feel so comfortable that some people may drift off to sleep. Hello, Francine. Yes, we're doing facelift under local anesthesia. The image lift, it's not a full facelift. People today come to us and tell us that they don't want a traditional facelift.
I feel that a little bit.
She feels a little bit there, so I'll do a little bit more numbing. So just right here. Do you feel any pinching here?
Mm-mm.
She probably won't even feel what I'm doing, but I'll put some numbing so that way she doesn't feel it. Perfect. Everything's looking good. Thank you for watching and thank you for sharing. For the physicians and students that are watching, this is the subcutaneous plane. And thank you to my team for setting everything up perfectly. Makes it very easy for me. Okay, release. Yeah, let's get release. And so we've lifted the skin in these areas here. So now I'll take my Brown Adsons and Cons facelift scissors here. Someone asked, how long does the procedure take? Well, it can take me anywhere from 90 minutes to a couple of hours, maybe 2.5 hours. I'll take all the time I need, always fast, but never hurry. And then we'll put the wrap on, we'll put the bruise patches on. Everything's looking good. Perfect. And now I make these little tunnels as I go through. Now I'm just connecting the tunnels, and then you have a continuous elevation of the skin flap. For the physicians and students that are watching, it's important that you leave a layer of subcutaneous tissue on the skin because that retains some of the blood supply. That calls it a hardy skin flap, hardy. And you get a better outcome, less breakdown of the tissue. It's a safer procedure that way. Everything's looking good. Exposure for me, please. Nala, how are you feeling, dear?
Good.
Very good. Thank you for watching. Thank you for sharing. Don't forget, we're on YouTube. If you haven't found us on YouTube, you'll see a little bright light here. Nala, are you feeling anything?
Nope.
Nala says she's not feeling anything. I believe her. Yeah, when you numb correctly, you just don't feel it. You may feel pressure. If she feels a pinch every now and then what I do is I'll do a little cautery, I'll do a little extra numbing medicine rather. And then she doesn't feel it. So that's the right way to do things. Behind the ear for me, please. But as you can see, there's minimal bleeding. Someone said, oh my goodness, I'd rather not know. Well, thank you for watching, Judy. Yeah, you don't have to know. You can come in and we can still do these things. Or some people just do fillers. We have permanent fillers, right? There's never been a better time to do a cosmetic treatment because the results are better, the training is better, It's safer when you have the right doctor. And the results are far superior than what we could get 30, 40 years ago. Very good. So now that we've got exposure and there's just really minimal bleeding, perfect. So I see there's this little vessel here gravitationally. It's up in this area. And I'm also going to be doing some suspension sutures, some plication sutures. So this is the Merceline F bond 2O. Thank you for watching. Thank you for comments. Very good. Yes, thank you, Cheryl. Appreciate that. It's all about having the right doctor, that's for sure. Just because you know how to do these treatments doesn't mean that you're an expert at it. And most people that do facial cosmetic treatments, they're either beginners doing the treatment, performing the treatment, or they're moderate level. It's really not as many experts considering the number of people doing the treatment. So you want to make sure you have someone who's very experienced, very well qualified. I'm double board certified. We train doctors all across the country. We have thousands of videos online with millions of views. Everything's looking good. Perfect. Thank you for watching. Thank you. Appreciate the comments. Margarita, appreciate that. Please do share and make sure your friends know you're watching a live procedure, because they're going to be upset if you tell them you saw this but didn't share it with them. And thank you so much to Nala for allowing us to share your procedure. Facebook was how you learned about us, Nala.
Yeah, but I'm very excited.
Well, we're excited for you too. And as Nala said, it was harder to watch the video than it is to actually do the treatment. This part's easy. We make it easy because, you know, we really have an amazing staff that take wonderful care of me, and they'll take great care of you. Everything's looking good. But please do share, and please do let others know. You know, a lot of people are unaware of what's possible, that you can do these treatments. So it's important that we educate them through videos and education. Educational talks, posts, Instagram, all of the above. You used to have to go to the university to see something like this and look over the shoulder of the attending, but now you just in your back pocket. We have a global broadcasting audience that gives us people from all over the world. I have doctors all over the world reaching out to me, asking about how we do this, and everything's looking good. How are you feeling, Nala?
Great.
Perfect. We measure blood pressure, we monitor oxygen, we monitor heart rate, but most importantly, we monitor Nala. So we flash the suture to keep the tension for the physicians and students that are watching. I'm throwing down the knot. When I move this back and forth, I'm just cinching down that knot. Perfect. So we've done the plication, and you can see all the excess skin here. So now what I do is I do a little bit of undermining just to make sure that it's even and that there's no dimpling. After you do the plication, for the physicians and students that are watching, you can sometimes see a little dimple. Well, now's your chance to remove that dimple by just doing a little extra undermining, a little dimplectomy. Now, you don't remove the patient's dimples when they smile, but you see all that extra skin. Well, we're going to remove that, okay? Everything's looking good. You're going to love it. So, Nala, what kind of exercise do you like to do?
I work a lot. Very physical job.
I tell people that they can get back into their routine physically within a day or two, errands, shopping, things around the house, but not 100%. Socially, we pass the grocery store test. 7 to 10 days, you walk into the grocery, no one really does a double take. So you want to listen to your body as you're easing into your physical activity. Everything's looking good. Can you hold that ear forward for me, please? And we're just trimming this extra skin here. In the back, we take that little triangle of skin out. Okay,
Take
thank
what
you.
want.
Yeah, we figured you didn't want it anymore, don't need it.
Take all you want.
Yeah, well, release, please. So you see how well that sits down there. Now I'm going to do just a little bit more cautery. Then we're going to stitch things up and put on the wrap and our bruise patches. So thank you all for watching. It's been an honor to share with you what we do every day. We are a center of excellence. This is all we focus on. And we have such a great team. We're always, if you're looking for a great place to work, you certainly, we're always looking for good people. Perfect. And behind the ear for me. So there's a little vessel over here that we can cauterize, or it's so small you can even leave it. When we put the wrap on, the pressure will hold things. Now you don't want to get too liberal with that. You want to be conservative and be very, you should be more inclined to cauterize than just let things be. Better to do too much than not enough. That's my opinion, and that's kept us very safe and had good outcomes from patients. Perfect. Now, when we see Nala back in the office, we'll do the wound care, we'll go through things, and then at 1 month, we'll go through her pictures before and after. And then she'll decide, does she want to do any filler, or she likes what she sees. So now we're doing a 2-0 vicryl deep suture closure. Let's see, I'm looking for the fine tooth. Perfect. So now for the deep stitch, thank you for watching. Thank you for joining. If you're just now joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon here in Tampa and in the Villages, Florida. So the deep suture can bring the skin edges together and almost close the wound without needing superficial stitches. And you can see how close that comes together. So there is a little bit of an opening right there, and we're going to close that with some of the 5-0 chromics and then another deep stitch here. So there's always variability to the tension in the wound and how the skin flap lays down. So that's why you have belt and suspender approach. You're doing a deep stitch, you're doing the superficial stitch, and all of those things together. The more stitches I put in, the closer the wound edges come. Because you can see that was a bigger gap before. I put another deep stitch, and look what happened. That comes together even closer. So we'll cinch everything together. Yep. And another deep stitch over here, behind the ear at the apex of the skin incision. Apex meaning the top. Very good. You're going to love it, Nala. Everything's looking very, very good. Perfect. Now, since I put the stitch, there's a little vessel that I can see, so I'll just... Perfect. Okay. A little tiny bit of cautery. I just like to be picky about things that way. Very good. Thank you for watching. Thank you for sharing. Make sure you're following on Facebook.com/ImageLift, YouTube.com/ImageLift, and Instagram at ImageLiftNow. Right now. Not later, right now. I'm going to place that suture one more time. I just want to reposition that one suture, so I'll just draw that through. I already have one knot that's placed where I want it to be. One pass of the suture, rather. So now when I'm measuring, if I pull this out, I'll see where the center is, and now I am perfect. I'm going to grab one more little bite here. There we go. All right, Nala, how are you feeling, dear?
Wonderful.
We're finishing things up. You're gonna love it. So now that the deep stitches are in place, we're gonna do the 5-0 chromic. Thank you for watching, thank you for sharing. And I'm going to reshape the tragus. So we trim this tissue edges here. Chromic. And we're really going to bring the skin edges nice and close together with stitches that are about 2 to 4 millimeters spaced apart. Perfect. At least 4 throws are enough, but sometimes I'll do 6 or 7 because I can. So that's about 3 millimeters, maybe not quite 4. 3 millimeters. I was talking to another doctor yesterday. I was showing him my phone. He's like, man, you have supervision, because I have my iPhone on the small text. And of course, as we age, the vision changes, but I still can see these little tiny stitches. They're about the width of a hair. Thank you for sharing. Thank you for watching. Very good. About 3 to 4 millimeters spaced apart. Perfect. Thank you for watching. Thank you for sharing. Thank you to Nala for allowing us to share and teach on her video. We are finishing up, and Nala, her driver, is going to be taking her home. I tell patients every 2 hours they should check to see if they need a pain pill. If you sleep for 6 or 8 hours in a row, you don't want to get behind.
With the
hydrocodone.
Mm-hmm.
So every 2 hours you should set an alarm, Nala, to wake up, even if you're sleeping, because if you sleep for 6 or 8 hours in a row, you don't want to get behind on the pain medicine.
But it doesn't say to take it every 2 hours.
Well, it's 1 or 2 every 4 for the pain pill, and some people take it 1 every 4, but you can take it up to 2 times every 4 hours. Everything's looking good. So I like people to at least check, because you definitely don't want to wait 6 or 8 hours, because it's not the end of the world if you get behind in the pain medicine, but we prefer to avoid that.
Okay.
Very good. Hello, Nina. Thank you for watching. Thank you all for sharing. Please do share. That way others can see what is possible, what their options are. We love to show the latest in technology for local anesthesia facelifts. You don't need the latest and greatest treatment if it doesn't fit for you. Very good. So we'll do a few stitches here, a few more stitches under the chin, and we're wrapping things up. We will be having more videos soon, so make sure that you are following. Or visit us at imagelift.com if you're interested in pricing, imagelift.com/pricing, or imagelift.com/events to come to one of our seminars. You'll have a great time, you get a free book, we feed you, we do raffle. We have seminars all across Central Florida. Please. Very good. I'm going to turn your chin all the way to the middle, chin all the way up for me, please. And now what I do, just to check the other side, take a big deep breath for me, please, Nala. Good. So it looks perfect by visual inspection. And I'll tuck one gauze here. I like to do 3. 1, 2, and 3. And then I'll take a few more gauze, and I'll just press on the other side to see, am I getting any venous return? Or do I see any blood on the gauze that I need to go back and see if I need to cauterize anything? So these are looking great. And you might see a little bit of serosanguinous, but nothing that shows anything that's significant. So if I get this, then there's no additional cautery to do. Let me look over here. Now release as best you can. So you see, look at that neckline. Look how nice that looks. Someone said, what's going on? If you're just now joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. We're doing a mass plication image lift facelift under local anesthesia. This is not a traditional facelift. I'm going to stand right here. So
I feel that.
She felt a little pinch, right? And I did a little bit of the numbing there. So how about now? Do you feel it? Let me see what I've got here. Excuse me. And then let me see the other one. Okay, yeah, this one's a little bit longer. Okay. How about now? Are you feeling any pain at all?
I'm just cleaning it.
Nala, are you feeling any pain at all, dear?
Not in the bed.
Okay, good. Everything's looking good. Okay, we're going to be putting some of the arnica patches on. I like to put a special wrap, and I show patients how to do all of the wound care. So again, we are 3 to 4 millimeters distance between each of these little stitches I'm placing. Sometimes I'll take a little extra skin here, but usually it's not necessary. Nala, how are you feeling, dear?
Good.
Perfect. Last few stitches. I'm very proud of Nala. Nala, thank you for being such a great patient. We didn't have to give you any warnings or anything like that. I'm just kidding. We don't give any warnings. Nala did great, and I will call later to check up on her. I give my cell phone to all my patients so that they can reach me at any time. We really don't get that many phone calls, but patients just feel more comfortable that they can reach me at any time. Very good. Perfect. Okay, Nala, you're completely done. So what we're going to do, we use a little bit of peroxide and Vaseline to coat the wounds. The moist wounds heal the best, and we're also going to put on our little patches. We're done with this. Okay, so you can see her neck and jawline there. Thank you for watching. Yes, thank you. Someone said, oh no, I would be sleeping for a facelift. And, you know, if you want to be asleep, you can sleep, but it's just not necessary to do. Yeah, you slept a tiny, you just drifted a little bit. But look at her jawline there, and look at her jawline here. Look, that's a super sharp jawline, but look at it here where she started. It's got the excess sagging skin, And now you see she's got a 30-year-old neckline. So very proud of you. And thank you for the comments. Our team, our assistants are amazing. Ari,
Thank you.
Nina,
I love her.
Charlene.
Thank you.
Ari is the best. She
Thank
really,
you,
all of
thank
our
you.
staff are really amazing. Charlene is amazing.
Thank you.
Nina's amazing.
The pre-op was really good.
Yeah, Laney's amazing.
Thank you.
Yeah, they did a great pre-op visit, so that helps to set the expectations for patients. So now, I put the bruise patches on a little bit differently because I like to cover the area where we actually did the lift and the procedure. So what I do, in these patches, you can see them here. These are the Ocumen patches from Sierra, and they're kind enough to provide these patches so that we can show on our videos. And yep, next patient, that's right. We're done. Like next.
So like you said next.
Someone said next. Okay. But they didn't say whether it's next patient or next procedure. I just
Oh.
next patient. You have one for, okay.
In
So
other
it's-
words, they enjoyed it.
they're ready for the next. So I just put this one here on the cheek, here like this. It feels a little cool. These patches, they do feel very cool and refreshing. And they deliver the arnica directly to the skin in the area where we've done the treatment. So I'll put a few more across the jawline. And then I'm going to put some on the neck. So right across the jawline where we did our work. And it's really been amazing because it really does help with the swelling and bruising. Patients are very grateful to minimize their swelling and bruising, and it also is a barrier for the skin to help prevent chafing. Because sometimes I would just put Vaseline across the skin to prevent chafing, but now these little arnica patches can do that for us. So I'll do this side, you can do the other. Then I use a lot of Vaseline. Coat the wounds. Oh, she clarified, she said next patient. All right, there you go. All right. So now once we do that, then I'll put gauze. And the patients don't have to have this type of, that's perfect, wrap, that they don't have to put this at home. I'm going to do it for them. And I like to make sure for the physicians and students that are watching, I make sure that there's gauze buffer 100% across the facelift area. Now this is a Curlex that I like to use. And then I'm coming across.
I'm just gonna hold your hand.
And then
your
Ari's
hand,
gonna
okay?
let your head rest all the way.
Okay.
She knows, she watched, all right. She knows the drill.
She knows.
Very good.
This is
Okay.
the part I dread.
Oh, well, it's the wrap. And when you take the pain medicine, the wrap does not feel as significant. So you're gonna get some rest. That's the most important thing. And this wrap is very helpful because you don't need a drain. It holds pressure nicely and evenly.
6 times.
That's funny. So Nala, you've seen us put the wraps on before? See, then that's great. If the patients have seen the wrap part, it's so helpful. It takes the fear out of it and lets people know. This wrap will stay on until tomorrow. We're going to take this off tomorrow and then go through the wound care with Nala, make sure that she feels comfortable with it. It's very simple. Now we do the brown wrap, and I do a little twist here, and then we're here in the back, and now in the front, twist under the chin. You don't push on the windpipe in the front, and now in the back, and then in the front again, twist under the chin, and then, yeah, it's right. Okay, so a twist right here under the chin, and then I'm putting pressure from behind the ear forward. Twist under the chin, then in front, then in back, twist again. Twist. It's gonna feel a little tight there. Hold on one second. It's just the last little one, and we're gonna adjust it. So this is the last part. Everything went very well. Thank you for watching, and we'll be doing our next video here soon. Perfect. Great job, Nala. Congratulations. We're gonna adjust